Let's start with wound healing. In wound healing, there is a stage called proliferative or collagen phase, and by the fifth or sixth day, fibroblasts appear. That is, by the fifth or sixth day of wound healing, fibroblasts appear and they proliferate to form protocollagen, which is then converted to collagen. And then these fibroblasts, along with capillary budding or blood supply, they form granulation tissue. Sometimes complication can occur in this formation, and that can lead to scarring, which is of three types, that is atrophic, hypertrophic, and keloid. Now, keloid, it is the proliferation of immature fibroblasts with immature blood vessels. This is an example of keloid, and it is most commonly seen in blacks. Etiology of keloid can be easily remembered if you remember the spelling of keloid, Keloid. It's a mnemonic. K for the key factors, that is the sites where keloid occur after surgery, burns, or vaccination. Then E for elevated levels of growth factor. Increased growth factor can lead to keloid. L for lacerations, that is incisions or small cuts can cause keloid. O for over the sternum. This is not exactly etiology, but it is the most common site where keloid occur. I for inheritance and injection. Keloid is hereditary in nature. And D for deep pigmented skin. Coming to the clinical features, it is not a true tumor. That is, it is caused by the complication in wound healing. It's not a true tumor, and it is very common and equal in both the sexes and hereditary in nature. The sites, as I told you before, can be vaccination sites, injection, incision, or piercing sites. And in the body, the most common site is sternum, where it will be in the shape of a butterfly. Now, the keloid, it can be red, vascular, and erythematous in nature, and the margins can be tender, and they can extend to the surrounding tissue with a claw-like process, and that is the reason why it is called keloid. Keloid or claw-like, it's easy to remember. And also there will be severe itching of this keloid. So that's all about clinical features. Next is, what is the treatment? Silicone application and retinoids are basic treatment. Then injection of steroid preparation like Kenacort can be given. Also intrakeloidal excision and skin grafting can be done, but make sure not to extend the incision to the surrounding tissues, because recurrence is a very common complication. So the complications are ulceration, infection, and also recurrence, that is local recurrence after excision. What are the questions that you can expect? Short note in keloid is a very common question, and also they can ask difference between hypertrophic scar and keloid. We'll discuss hypertrophic scar in upcoming videos. The reference was Manipal Manual of Surgery. Don't forget to like, comment, share, and subscribe. If you have any doubt, feel free to comment below. Thank you.